Hello everyone. My name is Anne Siskos. I work as a program advisor at the Institute of Holistic Nutrition. I also host webinars and I do some various other admin tasks behind the scene. I have a professional background in education and I'm also a graduate of IHN. It's my pleasure to welcome you all to today's webinar presented by Baljinder Chhoker. Sorry for that, Bal.
No worries, all good.
Comparative use of supplementation for arthritis and injuries. And it's an excerpt of the upcoming continuing education course, Supplementation in Clinical Practice. And I'll let Bal speak more about the content of the course a little bit later on, but it will be running for 9 Wednesdays, starting on May 8th. It's live over Zoom, 6:30 till 9:30 p.m. Eastern Standard, or 3:30 till 6:30 Pacific Standard. So registration has begun already, and it typically fills up. If you would like more information and to register, you can go to our website and go under the Continuing Education tab there. So the format for today is as follows. So Bal has an hour, give or take, of information. If you have any questions during the lecture that you wanted to pop in the Q&A, if he sees them as they come up and it's sort of relevant to the content there, he might answer it right during the lecture. Otherwise, we'll take them at the end. But yeah, just pop them in whenever they come to your mind, and I'll be keeping track of them. Now, about our presenter. Bal has been an educator and consultant in the natural health industry for over 2 decades. He's graduated from the University of Waterloo with a Bachelor of Science degree in Honors Science, and also from the Canadian College of Naturopathic Medicine with a Doctor of Naturopathic Medicine diploma. For over 10 years, Bal has been the national educator and consultant for Baljinder and Dr. Reckeweg. He conducts training sessions, educating both practitioners and retailers on various homeopathic and nutraceutical products, as well as recommended protocols for practicing clinicians. He has provided consulting services to several pharmaceutical and natural health retailers, gaining an extensive understanding of supplements available on the market today. He has lectured on the Human Anatomy and Physiology course at IHN, and currently he shares his knowledge and experience in the ConEd course, Supplementation in Clinical Practice. Please enjoy the lecture today, and welcome, Bal. I'll now pass it over to you.
So I want to thank everybody for taking your time out of your day to come and listen to, I don't even know what I'm going to say, let's just say, but you know what, it's valuable time that you're spending, and I appreciate it. So we're going to talk about comparative use of supplementation for arthritis and injuries. And the word comparative use is actually important here. That's actually how I teach my course, Supplementation in Clinical Practice. It's about comparative use. It's not just about listing supplements and, you know what, you figure out kind of where they end up and where they don't. But what I've always said is supplements are interesting in the sense that they're all similar, but they do different things depending on how you actually read the label and what it does. Every company gives you supplements that talk about, you know, it's for arthritis, and that's all they say, or it's for cardiovascular stuff, or, you know, blood sugar balancing, but that's all they say. But every supplement is slightly different, and it can do double duty in a way sometimes. So that's why the comparative comes in. And I know that you're not taught supplementation quite a bit in the actual course, the IHN, you know, course itself. So some teachers do bring up certain products, but my course is really all about supplementation. So I think at some point people need it. Diet, lifestyle are very important in the end. They're what's going to sustain what you are doing. But I think therapeutically, to get things going, get the ball rolling, to get them on a healing path, supplementation becomes crucial. We need more than just what's in our food to be able to handle therapeutically certain conditions. And arthritis and injuries are no different than all those other conditions. So let's get started here. And as I said earlier, as was mentioned earlier, put your questions in the question and answer, not in the chat, because if I see it and it's relevant to the slide that I'm on, I'm going to try to answer that question as soon as I can. If I do miss it, we will take care of all of them in the question and answer period at the end. All right, but I'll try to get this done hopefully within the hour for you guys. So you actually already heard all of this right here. My main thing is I'm the national educator for BioLorenco, Dr. Reckeweg. That's my full-time job. I do this course twice a year. I actually work retail 1 day a week to stay on top of all the products that you will see today, what I talk about in the course for all the supplementation stuff, and to do my real job as a national educator for BioLorenco. I don't think that you can educate people on your products if you don't know all the products that they're already using. So when I walk into a clinic, I look at the dispensary and I look at what they've got and where their gaps are. And we talk about how to incorporate. And my biggest thing is incorporation of various products into what you're already using. So, that's what I truly do. But today we're going to talk about arthritis and injuries. I cannot teach anybody anything. I can only make them think. That's what I do, is imparting knowledge, right? I just want to give you something that you can use somewhere. All right. So take what you like from what I say tonight and leave what you don't like. All right. Not everything is going to be for everybody. All right. So I actually say this about anything that you go do. If you're going to go preceptoring with a practitioner, if you're in school, you got to do some preceptoring hours. If you are listening to a webinar of mine on different companies, anybody's, all right, take what you want and leave what you don't like. That's how you just keep going with what you need to do. So I'm here to make you think about, what would be good for your type of practice, or if you're working retail, what to use, what you want to use for your families. It's not about protocols. All right. I don't like that. I use what you can use for that individual. That's how I like to do things. So, musculoskeletal system, we'll give you some anatomy physiology, which as I said, I'm not a big fan of special teaching, but you know what? You need the background. It consists of the bones, muscles, tendons, ligaments, joints, cartilage, and other connective tissue. And what does it all do? It provides stability and movement for the human body. That's what the musculoskeletal system does. So you think about everything that we do from getting up, actually even just lying in bed, but getting up from bed and doing everything else. That musculoskeletal system is what's going to allow us to do those things. Yes, all the systems are connected. Cardiovascular, respiratory, everything. But to be able to go out and do those things, you have to have a nice, strong musculoskeletal system to be able to do those things. And we know when we have issues, all right, how hard it is to do things. When the muscles are all tight and, you got sciatica, because of all of that, you can't move, you can't function, you're not happy. All right. So we want to make sure that whatever you do, all right, is about giving you the stability and movement that we need. Injuries and diseases of the musculoskeletal system result in the inability to walk, sit, or even breathe. If you've ever had a rib out, boy, you know how hard it is to breathe. Every time you take a breath, you get a sharp knife-like pain if you've had a rib out. Okay? So you can get a lot of issues, okay? And it does impact the health, all right? And then it eventually impacts your mental capacity too, and your emotional state on top of that, all right, depending on how bad it is. limitation in the physical functioning. It gives you fatigue. It affects the mental, emotional state. Because if you can't do certain things that you love to do on a daily basis because of a particular musculoskeletal injury and or pathology, you're not a happy person, right? So it can affect your whole lifestyle. General aches and pains can be a result of day-to-day activity, which happens. We stub our toe, we do this, whatever it is, we twist the wrong way. All right. Things happen. Sports injuries, big time. Young kids, elderly, it doesn't really matter. When we were dormant for 3 years sitting at home, not being able to go out, and all of a sudden we started playing sports again, a lot of injuries creep up, right? So, and they did. And so people had issues. So what's the result of all those? Leads to pain and inflammation. And depending on how severe it is, it might require some treatment, or it might not. And a lot of times, the basic stuff does go away within a couple of days. If it hangs around, then you got a problem. So, symptoms of stiffness on movement, bruising, localized erosion, all these things can occur depending on how severe it is. And when activities of daily living, such as social and work commitments, are often restricted, that's when we get functional and social limitations. And then eventually we get the emotional consequences. We get anxiety, we get depression from not being able to do what we love to do, be out and about, right? So it can play havoc on people's lives, right? It can be minor stuff, but when it gets chronic and it's ignored and it becomes a big problem, this is when the functional and social limitations occur. So we want to take care of it as best as we can. We want to help people move along, right, and do their things, all right, be able to do their daily things as best as they can. Let's look at some injuries stats here, okay? An estimated 4.27 million Canadians aged 12 or older suffered an injury severe enough to limit their usual activities. This is going back now 12, 13 years ago, 14 years ago, So these numbers as we come along are actually higher as things go along, right? So that's 15% of the population injury that limited their usual activity. Okay, so it went up from 13 to 15 from 10 years before that. It's gone up even more now that we're 14 years into that, after these stats. So overall, falls were the leading cause of injury. 63% of seniors, falls were their biggest cause of injury. Adolescents, 50%, and working age adults, 35%. Obviously, the older we are, the less stable and strong the system is. So there's better chance of these falls and creating injuries. Young people aged 12 to 19 had the highest likelihood of injury. Why? Sports, right? They're playing sports. A lot of times they're not stretching as well as they should, all right? So therefore, sports is going to create a problem. 2 out of 3 injuries among those adolescents were sports, as it says, right? So huge. Now, injuries happen while you're playing. That's fine. It's a matter of how severe is it that it takes them out of play. So we want to get them up and running again, and we'll look at some stuff that's going to help them up and run faster. Okay? Among working age adults, sports and work were related to almost half of their injuries, and 55% of senior injuries occurred while just walking and doing household chores, right? So it just shows you how we age, the weaker the system is unless we take care of it early on. So, a lot of stuff we're going to look at is just joints, and I'm not really going to talk about muscles, but, I think you all know you need good protein source to help with muscle stability and strength, right? So it's very important that they are getting dietary good source of protein. It's actually hard to get good dietary source of protein, right? So supplementation is probably going to be better, especially as they age. And if anything, at least branched chain amino acids to keep the core muscle strength there is going to be very important. And it's going to be important for recovery and just general maintenance. So don't forget about how important protein is. And people think out of the diet, we get lots of protein depending on what you're eating. It's about usable protein by the body. If you're not absorbing it, what good is it? So make sure that there's good absorbable protein in their diet to avoid such things. What type of injuries do people have? Sprains and strains are the most common, 51%, followed by fractures and broken bones. All right. For some types of injuries, there were clear difference according to age. Scrapes, bruises, blisters, 14% of injuries among seniors. Double what was reported amongst the younger, 6%. 26% of seniors and 21% of adolescents sustained fractures and broken bones compared to 14% of working age adults. A lot of working age, you're moving around, you're basically on the way of getting exercise, which is helping strengthen. Okay. So that's probably why. Growing phase in adolescence, right? If you're growing too fast, sometimes the body can't keep up. You see these growth spurts and a lot of bone issues with kids, right? Bone pains and even fractures. Because of the growth spurts, that's usually what happens. Seniors, well, the system is just getting weaker overall. The most common injury part of the body were the feet and the ankles. So for adolescents, teens, feet or ankles, 30%, 33%. That's more than double as seniors. Seniors, of course, you think about hips, you think about arms when they're trying to brace a fall, things like that. Okay. Where kids, they're playing a lot of sports. Feet and ankle sprains, things like that are going to be very common. A similar pattern occurred for injuries for wrists and hands that accounted for 22% more injuries in adolescents compared to seniors. Again, most of it's sports related. In contrast, injuries of the upper body, shoulders, elbows, arms, more in seniors than adolescents. Lower back injuries were more common against working age adults. Heavy lifting or doing too many things at once will generally create to that. Not being able to work out sometimes to relax the system will create that problem. So there's a reason why these numbers occur where they are. You just got to think about it. All right. And now that's why you have to help them with their lifestyle to counterbalance all of this. Naturopathic visits. This was back in 2016, a study done by the Ontario Association of Naturopathic Doctors. Okay. Musculoskeletal conditions hamper almost all adults at some point in their life. All right. But age related. But the thing is this, the number one reason why people went to a naturopathic doctor, all right, according to their study back in 2016, look at that, 30% back, neck, joint pain, and arthritis was in the 30%. Anxiety was way down there, all right, mental health. Now I'm pretty sure that's gone back up, all right, but you think about that, the number one reason was mobility issues that people are seeking help for. All right. And if you work in a retail outlet, you work in a health food store, you know how many people are coming in for musculoskeletal issues, arthritis being one of the biggest things, osteoarthritis being the, and osteoporosis being the other thing. People are coming in for this. Okay. So it is huge. You see it basically anywhere. What are these types of injuries? Okay. So I actually break it up into three categories here. Acute stuff, general trauma, automobile accidents, bumps, bruises, slips and falls, cuts and scrapes. Those are things that you can take care of right away. Automobile accidents require a little bit more, but the other stuff you can help take care of it right then and there. And you don't need sometimes major stuff for them. Acute to chronic, that's subacute stuff, subchronic stuff, basically fractures, sprains, strains, subluxations, movement of the vertebrae, all right, or joints out of place, soft tissue injuries, tendonitis, frozen shoulder. This can go chronic and become a long-term problem. And then we see the chronic issues, things that happened over time and become a chronic problem in general. Repetitive strain injuries and arthritis. So carpal tunnel, tendonitis, back pain, right? Chronic areas of abuse. And arthritic tendencies, knees, hips, shoulders, wrists, again, areas where there's just too much wear and tear. So these happen over years sometimes, and it can take years to start reversing the effect with all the stuff that you're going to give. Now, you may see decreased inflammation and pain, but the rebuilding side of it does take time. When you resist a difficulty, you antagonize it and it bites back. So one of the key things about treatment is the fact that we never want to suppress anything. We want movement to happen. If you suppress something, it will come back, and it will come back even harder. It's the last thing that you want. So when we talk about anti-inflammatories, all right, we don't want to stop this inflammation in its tracks. We actually want to move the inflammation out. We want the body to actually get rid of this inflammation, not put a Band-Aid on it, and then we overdo it. You take an Advil, you take a Tylenol, you take, some kind of painkiller that's actually going to put a block on it. So then you think you feel good, you go overdo it, and once that wears off, you're actually in a worse position than you were before. That's suppression. It's the last thing we want. So what do we got to do? So we got to look at the treatment side of it, how we're going to take care of it. So inflammation. This is, at the end of the day, this is what happens. Anything is going to cause inflammation. Inflammation leads to what? Leads to stagnation, destruction, and hindrance, depending on what stage you're at and where you start treating it. Stagnation, that's where we see pain, we see restrictions. That's normal. That's exactly what should happen when you have injury. That inflammation is supposed to stop you from doing stupid things, right? That's where the pain comes in and restriction comes in. What do we got to do? We got to get rid of, got to get the flow going. We get cellular flow, we get systemic flow, we get nutrients in, junk out, the body starts repairing itself. You're pretty good. First stage, great if that's when they would come to you, but they don't. Second stage, destruction. Pain sits around too long, stagnation sits around. All right, now we get destruction, we get tissue erosion. We also get increased scar tissue. All right, if that's the stage you're at, what do you got to do? You got to provide nutrition. That's the stuff we're going to look at. We're going to do tissue rebuilding. We're going to do tissue strengthening. All right, if that's when they came to you, good, but they don't. Third stage, hindrance. Decrease in quality of life and mood changes. That's when they walk in your door. When all of a sudden they can't do what they need to do, what they love to do. They've got a decrease in quality of life. Now their mood is all over the place. They get angry. They get agitated all the time. That's hindrance. Now we have to get complete healing going. Physical recovery and emotional recovery. Bottom stage. If you did this at stagnation, boom, we're there. We're done. You do this at destruction, you know what? No big deal. A couple of months, we're getting better. Okay, moving on. Hindrance, man, when you got to do the physical and the emotional, that's a lot of work. That's a long way back up to recovery. All right. So all of it's caused by some sort of injury or trauma, arthritis, you name it. All right. But we got to support it to speed up the recovery. We have to support that inflammation. So it doesn't matter where they're coming in. It just means that you have to let them know, well, we're at way down here. We got a long way to go before we can get back. All right. Or we're good here. Nah, you should be moving, moving up and about pretty soon. Depends on the stage. Sorry. Let's go back here. So goals of treatment. Mitigate the inflammation. That's how we're going to get pain reduction and symptomatic relief. We have to optimize the blood flow, within the affected area. Stimulate cartilage recovery by promoting tissue oxygenation. Improve blood flow, you improve oxygen and nutrients to that site. And when we think about it, just so you know, a lot of our connective tissues are associated with the joints, arthritis and injuries. All right. It's a poor vascular area. So it's actually even harder to get things down there. Harder to get that blood flow, right, to those tendons and ligaments. So we can't heal them as fast because we don't have the oxygen, we don't have the nutrients to support the healing. All right. So it requires a lot of work to get these things to where they are so we can get the healing going. Okay. And on top of it, there's absorption and assimilation. And I think we all know that people have got gut issues. Not everything you're going to take in is going to get absorbed. Half of it's going to go out because your gut is just not able to handle everything because you've had gut issues, gut inflammation, leaky gut, you name it, right? So you're also you're fighting against that side of it too. So the optimization of nutrient intake to support cartilage metabolism is what we're looking for. This is how we're going to be trying to treat these people. Get rid of the inflammation, improve the blood flow, and give the nutrients to support cartilage metabolism. So the basics. Sorry, oh man, my slide's moving too fast here. So the basics. What are we going to be looking at? We'll be talking about the stuff on the right side, and a little bit of this stuff. Here's what we need. We need anti-inflammatories, if you want to call them anti-inflammatories. Okay. So there's turmeric, boswellia, enzymes. So those are going to be very important. We're going to look at cartilage builders, glucosamine, hyaluronic acid, eggshell membrane, collagen, anti-inflammatories like MSM, silica. All these are building support things. So that's what we're going to look at in this lecture tonight. But the other stuff, the basics, they need protein. I already mentioned this. They need the building blocks for everything. Proteins is the most important thing, I think, or most efficient thing that people have is good, usable protein. Proteins are the building blocks of your immune system, your neurotransmitters, and remember the third stage, right? Third stage when the mental emotional state comes in, those neurotransmitter proteins are crucial for that. And they're the building blocks of practically everything else that we make, right? Protein is for muscles and it is for, the joints, all that stuff. And when we think of collagen, by the way, it's just amino acids, right? It's just different forms of amino acid depending on the source. Whey protein, plant-based protein, collagen from bovine and or marine, just slightly different amino acid profile. At the end of the day, it's the building blocks, amino acids. And I don't have it in the webinar, but look up master amino pattern, MAP, master amino pattern, my favorite protein or amino acid supplement out there. It is pills. It is the 8 essential amino acids, the building blocks of everything. So essential, you guys know they have to come from our diet. We can't produce them, but those essential amino acids will produce every other amino acid in the body. A master amino pattern, or MAP, does that in the highest usable, absorbable form without any load on the kidneys out there. Expensive, only in pill form, but really the best thing that you could actually ever use as an amino acid formula. To me, the best product in the world, period. Other stuff, greens, multivitamin minerals, vitamin D, probiotics, gut health is really important. Essential fatty acids, I think we'll look at a couple specific for inflammation. All right. So all the basics, you want to have them covered depending on the situation, right? If they're not getting enough nutrients, well, how are we going to help the body repair in general? Okay. So inflammation. Inflammation reduction will allow for quicker recovery from the injury, pain, and arthritis. So we have to control that inflammation. I didn't say stop the inflammation. We have to control that inflammation. It's there for a reason. Remember the very first part? That's the inflammation we want. We want to stop the body from hurting itself more. So we need that inflammation to stop the body so then it can eventually repair itself. So let's start off with proteolytic enzymes. So as I said, there's going to be botanical, which are plant-based. And then there's a proteolytic, which are enzymes, digestive enzymes, not for digestion of your food, but to reduce or remove the inflammation out of the system. Systemic enzymes or proteolytic enzymes are actually done on an empty stomach. Unlike your regular digestive enzymes that you do with food to break down your food better so that there's less load on the digestive system. All right. Proteolytic enzymes or systemic enzymes are done on an empty stomach. This is why they are enteric coated. So they're coated that they won't break up with the hydrochloric acid. They go straight into the small intestine before they will break up. The tablet will break up, okay, so that it can go out and support the inflammation in the body. Empty stomach, at least an hour away from food, is how we do systemic or proteolytic enzymes. So what do? Remove inflammation from the body. Not stopping it, removing it, pushing it along, including blood vessel and general trauma inflammation. They also help with breaking down plaque tissue and scar tissue. So you think of chronic injuries, repetitive injuries, chronic sprain of that one ankle, scar tissue is going to build it. Helping break up the scar tissue. This is what enzymes do. Enzymes break up things. That's their sole purpose. Break up things so the body can use it better, or in this case, heal it better. They help to improve blood flow, and they help drain the inflammatory toxins out. My favorite being Wobenzyme N, okay? Not the one in the box, the Wobenzyme Plus. It's supposed to be less pills in the Plus. I find you need more than what they say, so the N is still the best. Ridiculously gone up in the last, I'm going to say 3 months when it finally came back off a back order, but it is probably still the best systemic enzyme, okay, out there. So again, improving, okay, the inflammation reducing the inflammation out of the system for arthritis and injuries and any general trauma. This is not vegetarian, just so you guys know. Pancreatic. There's pork-based tissue in here. There's bovine-based tissue in here. Both. All right. So you need to know that this one here actually has only the bovine on the right side. The trypsin is from bovine. Okay. Actually, I lied. It says Sucrofa or bovine. So it could be pork based in that. So you don't even know until you actually ask them based on the lot number. So they're not vegetarian. First thing to note. So it's not going to be for everyone, because there's always lifestyle and religious restrictions you have to be careful of when you give things to people. Okay. But to me, if they could take it, really the best systemic enzyme out there. Okay. Been using this for basically 30 years now, okay, for my whole family, for injuries. Now it's my young kid, 17, playing basketball since he was like 8 years old. All the injuries he's gotten, he basically lives off of Wobenzyme just to keep himself up and running and going again. All right. So it's been used for so many things, but in this case, I said number one use is musculoskeletal stuff. You do have to do quite a high amount of pills. They're small pills. They're like the size of a button, or a little winter jacket button, you know. So, well, I shouldn't say that, smaller. Size of a thumbnail, let's just say, those tablets. So you have to do quite a bit. You're looking at about 3 to 5 tablets a couple of times a day. Empty stomach, at least 1 hour away from food. The other ones are supposed to be about 2, but I find that you still need 3, 4, all right, to do that. So the key thing is empty stomach, to find the areas of inflammation and start accelerating its movement out of the system. They're used for so many things. It's not just injuries and arthritis, cardiovascular issues, things like that too, sinus issues. So many uses. Wherever there is inflammation, you can use proteolytic enzymes. The other proteolytic enzyme is, serrapeptase. Serrapeptase now is your vegetarian version. Serrapeptase, well, it's considered vegetarian. So this is another proteolytic enzyme, and this is actually one of the strongest ones. The strongest out there is 120,000 IUs. All right, this is one of them. NRX has got it. Biomed has got it. This one's very unique. It has the serrapeptase, okay, proteolytic enzyme, kind of like Wobenzyme, enteric-coated again, empty stomach, at least 1 hour away from food. This one also has curcumin in it. All right, it has the boswellia in it, ginger in it, so all these other botanical anti-inflammatories, but the high dose of serrapeptase. So again, removing the inflammation out of the system. This is why it's enteric-coated again, for the serrapeptase, for the bromelain. away from food to help move the inflammation out of the body. So those are your two options, which I still think for chronic issues, proteolytic enzymes are probably still the best way to go. All right. Acute issues is a different story. All right. If you're talking about acute inflammation, botanicals will always work better. So things like turmeric, anything with the turmeric in it. Okay. So curcumin is the active component in turmeric. Okay. The main active component. But turmeric and boswellia are great anti-inflammatories. They are quick acting. So when something has just happened, there's lots of pain and inflammation associated with it, the botanicals will do a better job. Systemic enzymes, the other stuff we just talked about, serrapeptase, wobenzime, right, are better for chronic, ongoing, and with scar tissue problems. So when you think about arthritis, things like that, it's ongoing, enzymes are usually going to be a better way to go. But if you just injured yourself, right, this is where we start off with the botanical stuff. So the AOR curcumin active, probably one of the strongest and fastest acting anti-inflammatories you can say that's out there. Okay. It is high dose, 133 milligrams of a well-bound. Like it's not about the dosage of curcumin. Okay. You can get 500 milligrams of just plain old curcumin, 95. You can get, 1,000 milligram pill of just good old curcumin. All right. It's not going to work as well as a well bound into a fat base like this is. This is about giving you the true free-form curcumin that gets into the site to do the job. The other stuff, well, basically almost just goes right out of you because the body just detoxes it right out. Okay, good old curcumin 95 or plain turmeric powder, things like that. You need tons of it to actually get the job done, whereas 1 to 2 pills of this well bound into a fat globule, you could say, all right? So the turmeric's in the middle of that fat cell so they can get into the cell membrane much quicker. That's why AOR curcumin active, probably the fastest acting, 2 pills a day for great pain relief. Yes, you can use it chronic. Yes, there's other uses for this long beta form, great for the mind too and the brain health, okay? But injury-wise, fastest acting turmeric you're probably going to find. A couple pills a day and the pain starts to subside within a couple of days. Cytomatrix, curcumatrix, same mechanism. Basically, again, free-form turmeric into a globule of fat, okay? This is only 42 milligrams. The difference here is, and why I've chose these two to talk about, you see polysorbate 80. This is a synthetic emulsifier. The one before is using soy lecithin. There are people who are sensitive to soy or can't take any soy, all right? Then they will use the curcumin active. But you do need a higher dosage. You need 3 pills to basically equal what's in 1 pill of the other one. So if you're okay with the soy, all right, some people have an allergy or whatever, all right, then they can't, all right? But if you're okay with the soy, the other way is going to be better. But same mechanism, same high utilization in the system, bound to a fat, just 2 options based on soy or non-soy. But my favorite blend is actually this guy. It uses the same turmeric as the very first one we just looked at, curcumin from AOR, the curcumin active, but 80 milligrams. All right. And then we've got boswellia in here. That's frankincense. All right. And we got ashwagandha. So we got 2 forms of anti-inflammatories, curcumin and boswellia. But the ashwagandha is very important because it balances the cortisol. So high cortisol means more inflammation. So this to me is one of the best full spectrum anti-inflammatories that you're going to find, the fastest acting. 2 pills, once or twice a day can really minimize the pain within a couple of days, 3-4 days. That's it. And it'll take care of that fast. And then you can start moving along. I had a question. This is going back to when I guess I was talking about amino acids. Which particular amino acid is effective for injury? And I don't know if there's something else on that. Well, I can't see it. for injury and something else. So normally amino acids in general, there's different forms. If you want to look at that, go to CanPrev's website. They actually have trademark collagens, amino acids, collagens for bones, for muscles, for tendons, all right, full spectrum. They go read up on the turmeric, the collagens that they've got, all right, which will give you the particular forms that you're looking for. It's more about the injuries and rebuilding is why we're using collagen, not so much for inflammation. Inflammation, we're talking about the botanicals, okay? So CanPrev's website, they talk about all the different collagens that you can use for particular systems or organ systems within the body. Go look at those, please. Okay. So inflammation relief, as I said, one of my favorites for any type of trauma, injury, even gut inflammation is very good. Okay. So inflammation anywhere. The reason why I like this, as I said, yes, it has the ashwagandha for the cortisol, but it has the best turmeric out there, the form, bound turmeric that you have in the fat. But boswellia is very important because boswellia long-term becomes a better anti-inflammatory than turmeric. So if you're going to use this for long-term stuff, the boswellia is actually one of the key things that for chronic becomes a better anti-inflammatory and pain reducer than turmeric. Basically, once you're in the month of using this thing, boswellia really takes over and does what it needs to do. So those are your botanicals. Now let's look at a couple of blends. We kind of had this in the serapeptase one earlier, but this one has serapeptase, the NFH inflicom, but it's only 20 milligrams or 2,400 IU. We had 120,000 in the other one. This one is more of a bromelain, curcumin blend. And some boswellia. And those are your key anti-inflammatories, but it does have the enzymes. Bromelain's an enzyme, all right? It has a root and trypsin that the wobenzyme had too, and serapeptase is an enzyme. So this is enteric-coated. It has given you a 2-in-1, but I think that the one from Provita definitely stronger acting than this guy here. This gives you a blend of wobenzyme and general botanicals in a way, because the root and the trypsin and the bromelain that are also in the wobenzyme, all right, those proteolytic enzymes that we see are really crucial. So this is enteric-coated. You're looking at about 2 capsules, 2 to 3 times a day of this guy, but it gives you the 2-in-1 blend, empty stomach, okay? Sorry, I should mention, the inflammation relief, the curcumins are all with food. So those single ones that we just talked about. But anything with enzymes is always going to be enteric-coated, so you do them empty stomach. All right. And EFAs. I mentioned this as the general stuff that you need to be having. All right. But what kind of essential fatty acids do you need? It's all about the EPA. So when we look at these, when we go look at a fish oil bottle, okay, there's 2 key components in fish oils. There is the EPA, and then there is the DHA. So EPA is the key thing that's going to help with inflammation, cholesterol support, mood support, functional. Anything that's functional, that's EPA. Cholesterol, mood, inflammation. DHA is structural support. Structural support comes brain retention, cardiovascular structural support. DHA is actually crucial too, right? But when we look at inflammation, which is really what we're talking about when it comes to arthritis and injuries, all right? When we look at cholesterol support and we look at mood support, which can happen at that 3rd stage when their anxiety kicks in, their depression kicks in, all right? That's all EPA. So the higher the EPA, the better it's going to support trauma, injuries, arthritis, okay, mood. So this guy here, per teaspoon, this is very high EPA, 2,200 milligrams of EPA per teaspoon. You need about 2 grams of EPA to help with proper inflammation on a daily basis. Okay, if you're doing fish oils, you're going to need 2,200, about 2 grand of 2,000 milligrams of EPA. So a lot of pills. It could be 4 or 5 pills. And a lot of the liquids that are out there, it's usually equivalent to about 2 teaspoons. All right. This is one of your most concentrated. So I bring that out to you. Okay. So liquid is always going to be a lot easier because of the dosage. Usually 1, maybe 2 teaspoons does the job. When you're looking at pills, sometimes you need a lot of them. But there's people who won't do the liquids. All right. Taste wise, you got to keep it in the fridge. You got to finish it off very fast. Within about 90 days, it better be done. Otherwise, it's going to go rancid. Hopefully, you do it faster than that. So that's the downside to the liquid. But the pills you can keep along, you can keep them for much longer on the shelf. You don't even have to put them in the fridge. All right. You have to do much higher dosage though, but you can travel with it too. So it just depends on the person and what they want to do and how they're going to be able to get that 1,500 to 2,000 milligrams of EPA to do the job. Okay. So it's all about the EPA for the inflammation side of it. Topicals. Topicals are really important because they give some quick relief, but they don't do much for the healing, but they do give some quick relief. Okay. And people like topicals. So whatever you're helping them with internally, because the true way to heal is going internal. All right. Giving them something topical that they can feel doing right away. And, them massaging the stuff in helps them feel better too. It's a good idea. But they're going to do more than just feel good. They actually do, depending on what you use, it's going to actually help with the irritation, the inflammation, and trying to reduce the healing time. So, I think everybody has heard of arnica. Arnica in a botanical or a homeopathic is probably the most important thing, and it will be found in all formulas, all right, for injuries, trauma, and reducing the inflammation of any kind. So the purpose of arnica, okay, by the way, you can't take arnica internally as a plant. Homeopathic you can, but not a plant. It is very poisonous. Okay, so this is why you make it into homeopathic. Topically, as long as you don't put it into an open cut, you're good. So it helps to reduce the tension, inflammation, hemorrhaging. It gets rid of the hematoma, the bruising that's there, and it accelerates the healing of these wounds. So we use this after any type of injury, trauma, chronic inflammation, all right, sprains, strains, arthritic conditions, and even neuralgic conditions. So what we see, you borrow arnica gel. They also make a cream. You can apply. There's arnica oil from Dr. Reckeweg. So depends on if you want to massage it in or you just want that soak in quick with a gel into that area. So it just depends. If it's a large area, like you really hurt your whole back, then taking the arnica oil is going to be a much better way. Massaging that in is going to be much better than putting in a gel, okay, or a cream, which is harder to massage through. So it, again, depends on the area and type of injury that you would look at this. My favorite is the R55 Plus cream. Now, it's my favorite, completely biased because I formulated this thing, all right, with Dr. Reckeweg, but it works. That's really why I talk about it. Okay. This is a trauma cream. It is a gym bag cream for all types of trauma, sports, and or accidents. But you can use this for arthritic issues also. Okay. There's going to be a better one coming up for that. All right. But arnica, number one thing again, the inflammation. But it also has rust toxin ruta, and those are very important for the injuries that we're talking about, sports injuries for those kids. Right, they actually help with tendon and ligament connective tissue support. Rust tox ruta. All right, tendon, ligament, connective tissue support. I think you can see my cursor. I'm hoping you can. Okay. So that's really important, the inflammation side of it. But the other thing that makes this really important and effective, all right, because trauma is not just inflammation. There's swelling, there's tension on top of that. So you need to get rid of all of those things to get the healing going. So it actually has magphos, which is homeopathic magnesium to get rid of the tension and the tightness. So you take the arnica to reduce the inflammation, magnesium to get rid of the tension. So there's your pain gone. Now, the other thing is lymphatics. That's your sewer system. Gallium. Gallium helps with, which is cleavers, it helps with lymphatic movement. So it allows for the good to come in and the bad to get out, so you can speed up the healing process. This is why I say this is a gym bag remedy. So it's really important to keep and apply directly over that area of injury so you can get the healing going for those tendons and ligaments much faster, and also the nerve, okay, things like that. So apply as needed as fast as you can over that area. Arthritis, though, this is probably better. This is actually a heating and cooling cream. So it has essential oils. By the way, this is not homeopathic. This is a botanical essential oil thing. And this one here, essential oils provide that cooling effect, that ice effect, right? When we have an injury, we ice it. And then later, we actually move on to heat and continued heat. So this guy here has the essential oils for the cooling, and it has something called VBE, which it's actually a synthetic heating agent like capsicum, but without the irritation of the capsicum that can do on the skin. So VBE is a heating agent. So this is actually a unique formula that gives you an alternating heating and cooling action. So basically, when we ice, we constrict everything. We stop that pain immediately in its tracks. But eventually, we have to open it up so all that stuff can move out. So this goes cooling, constricting, and then heating, so opens it up and pushes everything along. So we get this area healing faster, stopping that inflammation, moving the junk out, okay? And so it's really good for large muscle areas, large joints, things like that, because of its action on the anti-inflammatory support for that area. It also has glucosamine and MSM, which we will look at internally, all right, more so than externally, but it will get some of that localized support. But the key thing is the heating and cooling. So great for arthritis, sprains, strains, but really the arthritic and injuries where we need that heating and cooling effect. That's where Biogesic comes in. All right. We're going to look at now the actual building side of things. So I'm going to speed it up a bit, okay, because I know I can see the time there. All right. So we're looking at support. What do we do with all this? We enhance cell and tissue repair, tendon, ligament, joint, connective tissue support, and we're going to look at collagen stimulation. So how do we rebuild arthritic areas, all right, or chronic repetitive injury areas? Okay, so this is what we're going to look at now. The cell is immortal. It is merely the fluid in which it floats that degenerates. Renew this fluid at regular intervals. Give the cells what they require for nutrition. And as far as we know, the pulsation of life can go on forever. This is how important nutrition is. This is what you learn. You learn nutrition. So we need it. Question is, can we get it just out of our regular diet or not? We now need to support, especially when there's trauma, injuries, we're wear and tear gone, all right? We've gone to a pathology. We need to give it extra nutrition, supplementation-wise in most cases. So arthritis affects the musculoskeletal system, especially joints. So we have osteoarthritis is the main one we're going to look at. There is also rheumatoid arthritis and a couple of others. There's something we'll look at rheumatoid, but really majority of it is osteoarthritis, the general wear and tear of the joints. This is where we get swollen joints that result in damage. It's always this swelling and the inflammation that causes the damage. All right. And we get the pain and stiffness. When we get erosion of the cartilage, which covers the bone surface, so then we get bone on bone. This is where majority of the pain is. So when we're a bone on bone, really you're just a surgery candidate. All right. So if you're bone on your knee, you need a knee replacement. It's going to be very hard to get that cushioning, especially in the time that it takes years to really get that cushioning going. Okay. So when we lose the space, we lose the synovial fluid. That's what nourishes the joint and cartilage. So that we get even more pain. So we got to get all this back through the various things. Okay. What are the risk factors in a way? We got genetic makeup. We got physical demanding job, previous injuries. Wherever it's one-sided arthritis, it's usually because there's an injury on that one side. A fracture maybe on that ankle. All right. and it's fine on one side, but you can feel the arthritis on the other, on the injury side, that's usually because of an injury one-sided. Infections or allergies, particular foods can cause inflammation and create this to happen. Obesity, of course, the wear and tear, extra wear and tear from that, and even autoimmune like rheumatoid. So what do we need? Very first thing to help with helping with the inflammation support and the symptom picture of the stiffness and the arthritis and the injuries. R55. We looked at the cream earlier. This is the drops. This is the oral drops. Okay, so a little bit slightly different formula, but all types of fractures, sprains, strains is what we're looking at. Concussions. All right, repetitive stiffness in the joints from arthritis, things like that. This is the homeopathic thing that's a great addition to all this other stuff we're going to look at. All right, this won't be your first go-to, all right, for people who aren't familiar with homeopathics, but this is a great addition to all this other stuff that we're going to look at to support the symptoms quicker with the homeopathic internally. Usually, just so you know, it's about 10 drops, anywhere between 3 to 6 times a day that you can take these orally. All right, rebuilders. So this is going to be the main stuff that we need, okay, to help rebuild from our arthritis. And depending on where the injury affects, this is also going to fall into play, okay? Injuries, I love the topical stuff better than practically anything else, and the acute botanical-based anti-inflammatories. You need that to manage that inflammation so that the body can do the rest. That first stage of inflammation we looked at, that's injuries. So you don't need much for it other than let's manage the inflammation and give the body the general basic support it needs. But osteoarthritis, this is the wear and tear, cartilage loss. So the original stuff has always been glucosamine. And recovery, Purica's recovery, this is the extra strength, which has the hyaluronic acid, gives you the most basic things that you need. MSM, which is a collagen precursor, glucosamine. This is a purely vegetarian or vegan formula. Okay. It has got the vitamin C, the magnesium, hyaluronic acid. It's all collagen supporting as much as you need. By the way, the amount of glucosamine you need is 1,500 milligrams to do the job on a daily basis. That means 2 teaspoons or 10 capsules of this. But it gives you one of the best all-inclusive, fastest-acting things I've seen with glucosamine in it, the original stuff. Reason being that it works faster than most glucosamines. You can get glucosamine, chondroitin, MSM formulas, okay, just that's it. It's their Nutracol blend that they've got. That grapeseed extract and the green tea help improve circulation better, right? You're strengthening the blood vessels. You're getting more nutrient flow, again, remember, into low vascular supply areas. So that's how we speed up the recovery with this formula here. It does it faster than regular glucosamine by almost half the time. And hyaluronic acid is important because it provides fluid and greater cushioning faster than anything else, really, that's out there for that synovial fluid. So you are talking high dosages with this, right? Maintenance would be the 1 teaspoon or 5 capsules. Therapeutically, you're looking at double that, right? But it gives you anti-inflammatory support with the MSM and also collagen with the glucosamine and the MSM doing that and the vitamin C, so on. So you're getting a lot of support with this. High dosage, but does a really good job. Another one here is the Sisu number 7. 7 things in here. Now, this is one that you can actually use for also rheumatoid arthritis. Reason being, so this has got your anti-inflammatories. It has got your boswellia. It has got your turmeric. It's got your ginger. Things that we've already seen, all right, for quick inflammation reduction. White willow, which is aspirin, natural aspirin, right? So all those things are important. But, so 2 things in here that make it unique. That the type of boswellia that they're using is probably one of the fastest acting boswellias you're going to find. And remember what I said earlier, turmeric, great anti-inflammatory, boswellia long-term, even a better anti-inflammatory. So really good, fast acting, okay, and long-term support. But this formula here has one key thing, and that's really important here is the cartilage, the chicken cartilage, okay, which is known as unhydrolyzed collagen type 2, UC2, a particular trade brand that's used. This actually helps preventing further collagen breakdown. So yes, we use it for osteoarthritis, but it's one of the few things, UC2, that is used also for rheumatoid arthritis. So if somebody has rheumatoid arthritis, you want something with UC2 in it. So that's the second ingredient, cartilage. Okay, the chicken cartilage, UC2. That actually works on the immune modulation. So it also helps prevent further breakdown of that cartilage. And remember, rheumatoid arthritis is inflammatory and immune-related cartilage breakdown. So yes, you can use it for osteoarthritis, but it's actually also good for one of the few things that's good for rheumatoid arthritis. One pill, maybe two, will do a good job, and you start seeing the results within about a week to 2 weeks with this thing here. Gets the joint flexibility back. It promotes collagen synthesis, but also prevents its degradation. That's what's unique about this product. Reduces the inflammation, so all types of rheumatic conditions. Platinum Relieve X. Interesting, guys, formulas, what platinum does. Platinum is what I call for the lazy people, because they always give you the oils. So we got glucosamine, we got curcumin, we got boswellia, a couple of other anti-inflammatories. At 500 milligrams of glucosamine, and remember I said 1,500 milligrams what you need, that's 3 pills. But what it also has is the fish oils. And remember what I said, EPA is really important. 200 milligrams of EPA per pill. So this is a 2-in-1 where you get your general rebuilders, anti-inflammatories, plus you get your fish oil, which is important for chronic inflammation. So just in 3 pills that you're supposed to do, you get 600 milligrams of EPA. That's actually very good along with the rebuilders. You can do extra fish oils on the side if you need to. But for most people who are not going to take too many things, this is the guy that you want to go with. So, somebody comes in, I hate taking supplements. All right, but I need this support. This is where you start because you do it all in one bottle, right? It makes it a lot easier for them. And now the main rebuilder that's there. Eggshell membrane. This has taken over the whole glucosamine side. Glucosamine was forever the main thing that was used. But when eggshell membrane came along, NEM, is a particular trademark of an eggshell membrane. It took over the whole market, as far as I'm concerned, of arthritis. Eggshell membrane is like the whole food version of glucosamine. It is naturally occurring collagen, glucosamine, and hyaluronic acid, and even chondroitin, all those things that are building blocks, but at a low dosage. 1 capsule, 500 milligrams of NEM, is like doing those 3 capsules of that previous formula, all right? Or that, basically like the 1,500 milligrams of glucosamine, 1 capsule can do this because of how easily utilized eggshell membrane is for the body to give you those key nutrients. So now 1 pill versus 3 to 6 pills, no wonder it's taken over, right, for arthritic support. So you're going to pay the same. You're just going to have a better patient compliance by doing less. Plus, this has the boswellia, which, again, the key anti-inflammatory that we want for long-term use. So quick acting. Within about 1 to 2 weeks, you start seeing the stiffness and stuff going away, all right, because of this whole food utilization of those building blocks. So really one of the best there is. There are other ones. Natural Factors makes just a pure eggshell membrane by itself without the boswellia. Genuine Health makes it. So there's other companies that actually make it with other things like fermented turmeric and so on, right? So you have options in those. All right, but if you're allergic to eggs, you don't do this, but you can go do the vegan glucosamine then. But really one of the best ways and easiest ways to do this. Now I'm going to give you a couple of other supporting things with this. I know we're getting up there in time, but I think we're almost there, all right? So OsGem, this is gemotherapy. I know most don't know what gemotherapy is. It's not what you think it is. This is actually a pure botanical. This is a pure botanical at the beginning stage of life. Gemmotherapy therapy is taking the buds and shoots of plants. If you know in springtime, you see the trees out there, they have these little buds and shoots. That's the proliferative stage, the beginning stage of that plant's life in a way to feed it and grow to whatever it needs to be. That's what we're giving ourselves. So these things that are in here are pure botanicals and extracted in not just alcohol, but glycerin, alcohol, and water. Normal tinctures are just in alcohol. Okay. And so we get other nutrients coming in. This formula is for bone and also some extra nervous system support, but really it's about the bone and joints. It facilitates assimilation of your calcium for osteoporosis, but it also remineralizes the body, gets rid of the waste, and improves the flexibility of the joints by supporting the connective tissue. Osteoblastic activity, so bone strength, putting down more bone. Pinus montana is really important as an anti-inflammatory, and cartilage and hard tissue support, rebuilding, so cartilage support. Sequoia, really important, is actually the anabolic guy. So when we think of testosterone helping to rebuild people, men and women, we need that. Sequoia provides that support for that anabolic state, so building state in the body. And betula helps with movement of everything, remineralizing everything. So this is something that you would consider more of as an add-on to whatever else you're doing to make it work better. So all that glucosamine, the calcium, whatever it is, to make it work better within the body. And silica, I think this is the last product we're talking about, so we're almost there. Silica is crucial. Silica, and BioSil being my favorite and probably the best utilized silica within the body. All right. Orthosilicic acid is actually how it is used in the body, and that's what we have in here. It comes in a liquid and pills. Liquid is terrible tasting. So you have to make sure it's in a juice, but it still smells and tastes like fish, even though there's no fish in it. So capsules, even though they're more expensive, people will go with the capsules. Okay. 2 capsules or 12 drops. Drops will have to be in some juice, as I said. Okay. So 2 capsules or 12 drops. Calcium, silica is really important for all collagen structures. People take silica for hair, nails, and skin, making them all stronger. But it actually helps get your calcium to the bones better. It helps get your glucosamine, that eggshell membrane or the other glucosamine we're talking about, into the joint better. It helps to strengthen your blood vessels. If you think about it, your arteries, that collagen that's in there that's allowing for the elasticity to happen, that's what silica is for. So it takes collagen structures and makes them more flexible without the breakage. So you don't get the tears in the tendons and ligaments. You don't get the fractures as much, right? So that's the purpose of silica. It's a great addition, and I think it should be an addition for chronic issues or for even acute fractures. You want this thing when it comes to injuries. It should be thrown into the mix. Okay? So those are the key products, okay, that we've got. I think your body actually reminds you about your age and your injuries. The body has a stronger memory than your mind. That's chronic pathology. It stays there. All right. You may think it's not there, but your body will remind you got arthritis. Your body will remind you, hey, that foot was injured before. That's why I'm feeling it there. Okay. Body remembers. So you have to make sure you're always supporting it. So why are we here tonight? Well, one of the biggest things is for me is to tell you about my course. So Supplementation in Clinical Practice course. It's starting, I think it was the second week of May, going till the first week of July 9. Well, actually, there it is. Actually, I did change the date. So May 8th to July 3rd. 9 classes. Somehow I've been able to get it done in 9 classes. There's been years where it's taken me 10 classes to do an extra class, but I think I've been doing much better now, making sure it's all there. There's your outline. We talk about why we're supplementing, all the reasons behind it, different types of modalities you've got, things like that. Then I break it down into conditions and things like that as to where we're going to comparatively look at the supplementation. So a 9-week course, if I didn't have to mark you because this is a continuing ed course, I wouldn't, but school wants a mark. So you got a quiz and you got an assignment at the end. Okay. But that's one part of this thing. It says you having to come to class or class time and listen to me talking about all this stuff, which I think will be helpful. But I work with about 20 companies to bring that course to you. And those companies are very nice to me, which means they're really nice to the people taking this course. So I reached out to the companies and I said, hey, listen, this is what I'm doing, but I want people to know about the products by using these products. So I want you to hopefully give me product for these people to use. So in the end, after reaching out, this is the kind of stuff that everybody walks away with, depending on the various companies. Sorry, these guys are no longer, but there's the stuff from Alpha Science. There's usually the stuff from BioClinic. There's usually some of the stuff from Sir Royal. Right? There's the stuff from Dr. Reckeweg. Astracryl is no longer, so I'm going to have to pick a different product from Biomed. Designs for Health, Bell Lifestyles, Genuine Health, New Roots, CanPrev / Cytomatrix / Innovite, which is now all Cytomatrix anyways. Garden of Life. All right. Then there's still Purica. This is stuff. Okay. Pasco. NFH, Platinum. So those are all the things that you get. Okay. Now, when I started out, I thought I'd get people half of their money back. It's going back 8 years, so I thought I'd get them like $250 back in their fee by supplements. Just so you know, it's been 7 or 8 years. Sorry, I don't even know anymore. That everybody's walking away with a minimum $1,000 worth in retail of product. That's every student that takes my course. That's how nice the suppliers are. It's usually in the $1,200 to $1,500, but let's just say $1,000 for argument's sake. So I get double your money back just by dealing with the companies and you taking this course. So if the knowledge doesn't make you want to take the course, maybe the supplements will. All right, but that's just how I've been dealing with the companies all this time. All right. All learning is in the learner, not the teacher. Again, as I said before, take what you want. Take the good, leave the bad. All right. And it's how you want to learn it. Not everybody, not all courses are for everyone. Maybe it's not what you're looking for. All right. Most likely this is, but that's completely up to you. All right. So as I said, I bring this course for you guys to learn about the key products that you can start with. All right. That's what my course is all about. It's kind of like how I did this lecture tonight. Okay. So that you can go out there and start using the stuff for the key conditions that we're looking at. Okay. So it's a beginning point. All the learning, you're going to have to do a lot after this, okay, by dealing with the companies and so on. So there it is. There's my information. If you have any questions, you can email me. You can call or text me. All right. As I said, it runs twice a year, May, June, and then again in October, November. It's all online now, so it doesn't really matter. It's not in class. All right. So completely online, May, June, and then, as I said, October, November is the second run of the course. So I think that answers that. Is it class online? Yes, only online. Another question there. Can you give a child biocell has broken her wrist? She has broken her wrist 2 times in a year. Yes, you can. If she can swallow the pills, great. If not, you're going to have to hide the liquid in some sort of juice or some applesauce or something to get it into her because the taste, but it's a good idea. But I would also suggest, if that's the case, vitamin D and vitamin K. And you got to look at why it is happening. So do we have enough calcium in the system, usable calcium? All right. So calcium with the D and K plus the biocell, that's what you're looking at. I think that's the questions I see. I am going to hand this over back.
Yeah. Okay.
There you go.
Thank you so much, Bao. So comprehensive and informative. I know people who have taken the course in the in the past. Some of my colleagues have found it super useful. And like you say, there's so many companies out there. You have to know where to start for sure. And I'm wondering if there was another Q&A another question that popped up. Oh, I think we've covered them all that are listed
what
here.
I saw I covered. One thing I forgot to mention, just so you know, you can only take my course once. Because of those supplements that people get, all right, you can sit and audit the course maybe later if you want to, but you can't get the goodies twice. So you can only take my course once. Majority of the material is the same. I keep changing based off what's available, what's not. Over the years, things get discontinued, but I want people to know that, because people have tried taking it, but I had to stop them.
That's great. Is it the same course in the spring and the fall?
Yes. Oh yeah. It's like I'll have, as I said, we lose certain products over the years, and even I've set the notes, and all of a sudden, like even last time, there was 2 products that were in my notes that were there when I started the course, which were discontinued. So then this happens. So I have to change the notes accordingly like that. But it is the same course that I run twice a year.
Okay, fantastic. So if you want to register, go to the IHN website. You'll see it under the Continuing Education tab. And if there's no other questions, I think we'll...
There's one thing else I want to mention. Sorry. Minimum run on this course is 6 people, but I max out at 20. 20, no more than 20 can take the course at one time. Just so that you know, you may not, but I think everybody else in the office knows that that's between 6 and 20 is all that's allowed to take the course.
Yeah. Okay. That's good to know. And I believe there's been a wait list in the past. So if you're keen, go ahead and check it out. So thank you once again, Bal. This was a fantastic lecture. Thank you to all the attendees. And wherever you are, I wish you a great evening, a great day. And I hope that you've been able to take some of this information and be able to put it to good use. So bye for now, everyone.